It's now time for the sponsor perspective portion of the program. Please welcome Kevin Bernier, Executive Director of Advocacy Relations for U.S. Pharmaceuticals at Bayer.
Thank you for the introduction and welcome. I'm grateful to all who are joining this important discussion today as we aim to elevate the challenges facing many patients living with chronic kidney disease in the U.S., including those patients with type 2 diabetes. 15% of U.S. adults have chronic kidney disease, also referred to as CKD, and more than half of U.S. adults aged 30 to 64 are expected to develop CKD during their lifetime, a condition currently affecting an estimated 37 million Americans. It is important to note that type 2 diabetes is a major cause of CKD. Approximately 40% of patients with type 2 diabetes have chronic kidney disease. CKD accounts for more than 20% of total Medicare spending. And more sobering, 9 out of 10 adults with CKD do not know they have the disease. Perhaps the most devastating fact about CKD is that without treatment, the disease can progress from living with reduced kidney function to end-stage kidney disease or total kidney failure. Patients with end-stage kidney disease require dialysis or a kidney transplant to survive. Decades of underinvestment in kidney health screening, care, and treatment options have resulted in too few patients being diagnosed early and getting the treatment they need to slow their kidney disease progression, which may lead to dialysis. The U.S. Department of Health and Human Services is aware of this, which is why it is a goal of HHS to reduce the incidence of ESKD by 25% before 2030 through improved surveillance and adoption of interventions aimed to reduce the progression of CKD. However, adopting new interventions is slow while the challenges compound. And to really drive home this point, every 24 hours, 340 people begin dialysis treatment because of kidney failure. Once a patient is in dialysis, the 5-year survival rate in the U.S. is only 35%. While these statistics alone are alarming, health disparities in chronic kidney disease are truly distressing. Data have shown that African Americans in the United States, Aboriginal groups in Canada and Australia, and Indo-Asians in the United Kingdom are affected disproportionately by chronic kidney disease. Further, the associations of socioeconomic status and risk of progressive CKD and eventual kidney failure have been well described, with persons of lower socioeconomic status bearing the greatest burden. While Black Americans make up approximately 13% of the U.S. population, they comprise more than 30% of patients with end-stage kidney disease in the U.S. Health access problems faced largely by communities of color result in Black Americans experiencing a 3.5 times greater risk for progression to end-stage kidney disease as compared to white Americans. Moreover, Black Americans are more than 3 times as likely, and Hispanic or Latino Americans are 1.3 times more likely to have kidney failure compared to white Americans, which underscores the importance of ensuring timely, effective care among people of color. Data confirm that CKD is a massive and growing issue for the American health system. But while more and more patients are impacted by this terrible disease, access to screening tests and treatments remains woefully inadequate. A failure to perform timely screening tests often makes detection out of reach for many patients, exacerbating existing health disparities for those who already have less access to health care than white Americans. Furthermore, once a patient is diagnosed with CKD, they often face complicated and burdensome processes to access the medications they need to manage their disease. Recent estimates show that Medicare alone spends more than $120 billion annually on kidney disease. Both Medicare and commercial health plans generally see a cost increase as CKD progresses to later stages. While there is no cure for CKD short of a kidney transplant, there are treatment options to reduce the risk of kidney disease progression. But advancements in diagnostic testing and CKD treatment cannot begin to change the tide of the burden of kidney disease in America if patients cannot access them. We are hoping today's dialogue becomes a call to action. Our health system can and must do more to reduce the risk of CKD progression and bridge health equity divides in kidney disease management. There are essential benefits and services that need to be accessible to all Americans equally. We support the Department of Health and Human Services' Healthy People 2030 goal to reduce the burden of chronic kidney disease. We believe one strategy necessary to achieve that is to ensure patients have unrestricted access to medications shown to improve kidney health and slow the progression of CKD with little to no copays. We also look to policymakers to ensure that physicians and patients can select the most appropriate therapy without unnecessary barriers. Reducing health disparities in CKD must be our top priority. Preserving kidney function can also preserve health system resources and improve lives. I want to thank the many advocates who for years have been fighting for better access. Their efforts have led to improved comprehensive kidney health evaluation rates and address gaps in care for patients with diabetes and CKD. In closing, it is up to all of us to collectively ensure that patients are able to access the treatment options they deserve. Thank you.
Thanks again to Kevin Bernier, Executive Director of Advocacy Relations for U.S. Pharmaceuticals at Bayer.